Before we get started, we acknowledge, recognize, and respect the ancestors, elders, and families of the Bunwurrung, Wadawurrung, and Wurundjeri of the Kulin Nation, who are the traditional owners of this land in Victoria.
What is the health issue? According to the Australian Institute of Health and Welfare, cardiovascular disease death rate is much higher at younger ages, which is 8 times as high at ages 35 to 44 among Indigenous people. To be more specific, ischemic heart disease, or also known as coronary artery disease, is the most common cause of mortality rate for Aboriginal people. These are the facts that were recently stated by the Australian Institute of Health and Welfare, as well as Australian Indigenous Health Info from 2015 and 2020. According to Her Heart Foundation, there are many risk factors that lead up to cardiovascular diseases, such as environment, diet, for example, the traditional foods with high protein are now replaced with high salt, fat, and sugary foods. And lastly, smoking and alcohol consumption. Smoking is linked to an increased risk of cardiovascular disease and it is responsible for 9% of total burden of disease and all smoking related diseases such as cardiovascular disease, which are considered preventable. Therefore, a preventable method or approach are accessible, applicable, functional, and convenient because they are relatively inexpensive, educational can be passed from the generation to generation, and responsibility for health and well-being is being shared. One principle of this approach is empowering individuals and the community. We can do these by providing individual Aboriginal people and their communities with the resources they need to address factors that influence their health and well-being, as well as empowering individual Aboriginal people with health knowledge. And lastly, individuals can participate in decision making about their health and well-being. Overall, these will help decrease the mortality rate and morbidity rate of Aboriginal people in the future and achieve their optimal health.
Our demographic that we are wanting to reach are Indigenous peoples aged from 12 to 35 years old. Our concept aims to bring caution and attention to cardiovascular diseases within the young Indigenous communities of Australia. Cardiovascular diseases causes one of the most burdens among Indigenous peoples, which is 10% out of the other leading causes of death within Australia. This disease is more common for Indigenous peoples than for the non-Indigenous. In regard to treatment, it is known that Indigenous Australians are less likely than non-Indigenous Australians to receive treatment after a heart attack. Every Australian should not abide by this, as every individual must be treated fairly. Moreover, Indigenous peoples do not receive the same level of primary prevention, management, emergency and acute care, rehabilitation, ongoing management, and secondary prevention care for cardiovascular disease compared to non-Indigenous peoples who receive greater care for their own needs. To be more specific, Indigenous Australians with any sort of cardiac disease have lower access to specialist care than non-Indigenous Australians, which then leads to Indigenous Australians having a higher mortality rate than the non-Indigenous. In 2008 to 2009, the rates of hospitalisation for cardiovascular disease for Indigenous peoples within the states of Australia were twice as much of those of the non-Indigenous peoples. Consequently, within Victoria and many of the other states in Australia, cardiovascular disease was the leading cause of death for Indigenous peoples, with death rates for cardiovascular disease being twice of those of the non-Indigenous peoples. It is evident from the resources and data collected that First Nations people are unfairly treated medically, unlike the non-Indigenous, increasing the number of unsuccessful outcomes after or no treatment at all.
An existing program called the BDAC, which stands for Bendigo and District Aboriginal Cooperative, was founded to represent and provide services for the Aboriginal community. They also carry the responsibility of ensuring service growth and development of Aboriginal community, aiming to provide excellent health service and outcomes for their people, as well as improving the service quality of life. This program successfully provides this community with all healthcare services possible, such as men's, women's, and children's healthcare, diabetes care, as well as mental health care. They also practice tracking within their system, only if necessary though. Staff will follow up patients that did not attend or cancel a scheduled appointments, which can be beneficial for the community and individual if other services can be provided for them. Annual Aboriginal health checks are also recommended as a part of their service to ensure that people are receiving the right healthcare and encourage early detection, diagnosis, and intervention for common and treatable conditions that can cause early mortality and morbidity. For people and families impacted by mental illness, the social and emotional well-being workers offers a confidential counseling and assistance. They will promote leading a healthy lifestyle and consider preventative activities to keep individuals on the right track. If a person or a member of their family is experiencing stress and wants to chat with someone in a private, non-judgmental setting, well-being support can be beneficial. However, not all information is willingly to be shared due to trusting relationships between the workers and the clients, further impacting on their individual social and emotional health and well-being.
Our program is a service in which we will go around to rural Aboriginal communities in Victoria and promote healthier choices to food and physical activity. This program will involve 3 classes in each community we visit, where the classes will focus on informing the causes of the most common diseases for First Nation peoples, with an emphasis on cardiovascular disease, how the diseases will impact their lives, and also how to prevent the diseases. The goal of this program is to educate the younger generations of these communities, specifically ages between 12 and 35, of the health risks they may be exposed to, but also to enhance their self-determination. How this program will be organized and operated is with the cooperation and employment of Aboriginal health workers, nurses, and First Nation peoples who live with cardiovascular disease. They will deliver the classes explaining and educating the communities of the health risks of cardiovascular disease and the effects it can have on their lives, along with those who live with the disease detailing their experiences and what they are currently doing to improve their condition. All of this will be carefully structured and the information reviewed to ensure it is culturally appropriate and specific to the rural communities being visited, being respectful to country, with the outcome being that the communities have a greater understanding of their own health and also develop healthy habits and practices in relation to food and exercise. This program will also be done in collaboration with the local VACHOs near the rural communities. It is with their Aboriginal healthcare workers, nurses, and patients who are being employed to deliver the classes. This is intended to not only strengthen the relationship between the local rural communities and their healthcare workers, but to also increase their self-determination to personally seek out aid for their health. This is done on the premise of holistic healthcare. By engaging and supporting the whole community, it allows for every individual to achieve the best they can in regards to their health. In addition to the classes, individuals who are interested in further developing their knowledge in health and contributing back to the communities will be given the opportunity to complete short health courses such as first aid training and even certificate 3 and 4s in healthcare. These courses will be all paid for, with even further higher education being a possibility. The knowledge they will gain is invaluable to their communities, being the ones who will continue to educate and cultivate the teachings that the community has established, passing that on to the future generations of the communities. With this, the program has been able to not only educate the rural communities about their personal health and how to reduce the risks of cardiovascular disease, but also support the self-determination of all individuals in these communities, achieving the goal that this program has set out for. Thank you for listening.